Alright, we're going to go over femur. Femur is technically 2 views, but we will perform 4 images. You'll have to do 2 APs and 2 laterals to be able to fit all of the anatomy on one image. So you're going to use a 14 by 17 lengthwise, and then we'll just collimate down for the proximal images. So you're going to put your film in lengthwise. Dressing instructions for your patient are going to be everything from the waist down off. They can leave their underwear on as long as there's no metal on it. Gown is going to be tied in the back, and they can leave their socks and shoes on if they'd like. You need to ask name, date of birth, pregnancy. Ask your patient to verify the correct side and body part that we're x-raying today. If there's any injury, if so, what happened, how long ago, where the pain is at, and if there's any limited range of motion or previous surgeries. So go ahead and have a seat on the table, lie down on your back for me, head on the pillow, feet are going to go that way. We, again, want to make sure that we have the correct detector selected. We are in transverse detent and at a 40-inch SID. Actually, I'm going to raise the table up just a little bit so it's at a good working height for me. We're going to line the tube and bucky up, and then after that, we're just going to move the patient on the table. We're not going to touch the tube and bucky. I'm going to open my length up to 17 inches long so that I can get as much of the femur as possible. I'm going to have my patient scoot away from me on the table just a little bit. Good. And what I'm going to do is find the apex of the patella, and I'm going to center about 1 inch to 2 inches. I'm not going to center, I'm so sorry. I'm going to have light down past the apex of the patella about 1 inch. And have the patient turn their toes straight up in the air and rotate them internally about 5 degrees, which is going to put the knee in a truly AP position. And then I'm going to center midway between the medial and lateral borders of the femur. And I'm going to put my right marker in the lower corner there. I would just tell my patient to hold nice and still. There's no breathing instructions for this. And then after I take the distal femur, what I'm going to do is I'm going to collimate down to about 12 inches. And then I'm going to make sure that I overlap from my previous image at least 1 inch or 2. I want to make sure that I have light up to the as is. And I'm going to center at about the femoral neck, which happens to be just about 1 inch below the crease of the leg. For the proximal femur though, I do need to internally rotate the feet 15 degrees for this one, to get the head of the femur in a truly AP position and elongate the neck so that we can see it a little bit better. And then again, I would have my patient hold nice and still and hold their breath. Now I'm going to do the proximal lateral femur. So the patient's going to stay right where they are. All they're going to do is bend your knee up for me and let your leg fall out to the side towards me. My height didn't change, so all I'm going to do is readjust my central ray so that it's mid-femur at the same level. And I'm going to put my right marker in the bend of the hip here. I'll have my patient stay just like that for me, and again, hold their breath. For the distal lateral, what I'm going to have my patient do now, because now I need to get the knee into a true lateral position, so I'm going to have you roll all the way up onto your side for me, right up onto your hip. Scoot back on the table for me, and then bring this leg forward in front of the other one, just like we did on the knee. I'm going to open my light field back up to 17 inches in length. I'm going to make sure that I have light past the knee. I'm going to make sure that it's truly lateral, center midway between the anterior and posterior portion of the femur. And make sure this foot and leg isn't in the image. And then I would take that picture, just hold nice and still. In the event that your patient could not lay like this, you could shoot a cross table lateral distal femur. Okay, that's it.